So again, that's just thinking there isn't any kind of supplement. It's just whatever benefit is here is here. The elimination period is 180 days, which sounds a lot like 26 weeks. So it matches up with that short-term disability. And then the benefit period is to Social Security retirement age. Basically just means if an employee went out and was permanently disabled, they could collect on a long-term disability policy like this for, well, up to the age at which Social Security determines that they retire. So again, it's just an optional benefit that we included for your review. So any questions, thoughts, comments about the ancillary?
No, it's pretty straightforward.
Yeah, that's why I thought it made sense to start here, because it is less complex than the health insurance. So we will get into the health insurance, and I'll ask Mackenzie to help us walk through these two plans. But I will start by saying what we're looking at are two health insurance plans that are different than your current. One of them we consider an equivalent from the employee's perspective, and the other one is a whole new type of plan, and it would be a new idea to the town. But the big difference in the comparable plan, I say comparable because it is still quite a bit difference, is that you have a $3,000 deductible, and the town funds 75% of that. Right, I think it's so. The reason that you would go with a lower deductible is because it will reduce your premium. Like obviously, the insurance company, the health provider, will be on the hook for less medical expenses with a higher deductible. However, by self-insuring a big portion of that deductible, you're also taking on a bit of an exposure in deductible funding. So we're going to talk a little bit about that. And then the other plan is an HSA qualified consumer driven plan. That is a lower cost option, and it's an option that we can offer as on a voluntary basis to the employees, but there are lots of good reasons to get into an HSA qualified plan. And you know, we can help educate the employees about that, but anyways, that's going to be a whole different idea. All right, so Ken, do you want to just run through?
Jeff, microphone. Thank you.
You're welcome. So as Jeff mentioned, the HMO LP is our comparable plan option to your current plan that has a $3,000 deductible. So your plan currently is what's called a site of service, and ours is called LP for a low cost provider, which is the same idea or concept of being able to see an LP provider for scopic procedures, lab tests, and outpatient surgery for a lower out-of-pocket cost. So for this plan, it has the exact same copays that you would see for a PCP, which is your primary care physician, or a specialist. So for your PCP visits, you have a $25 office visit copay. For specialists, you're going to see a $50 copay, and that stays exactly the same for your employees. In addition to that, your physical, occupational, and speech therapy visit maximums, as well as your let's see here, your urgent care and emergency room copays, those are identical to this plan option as well. You will see acupuncture care has an increased visit limit. It's gone from your current has a 12 visit maximum. In our plan, it is a 20 visit. Yep. Your prescription drugs, currently you have a 10, 25, 40 for a 30-day supply, and on the 90-day supply, it's 10, 40, and 70. We don't have a exact comparable plan option, but for our most comparable is a premium 4-tier prescription drug plan that introduces generic medications at a $0 copay. So essentially any medications that fall under your $10 copay are now split into 2 tiers, because generics have 2 different types of prices. You got your lower costing generics and your higher costing generics. So that's how they transition over to a 4-tier. So tier 1, tier 2 are your generic medications of lower costing and higher costing. And then your final 2 tiers are getting into the name brand medications, the most expensive. So that's a nice feature as well, being able to introduce generic medications at a $0 copay. And that's both for the retail and then the mail order program. So moving down to the deductible. So as Jeff mentioned, this plan does lower the deductible exposure. So it would be $1,500 for a single plan. It's going to be $3,000 for a two-person plan and $4,500 for a family plan. Deductible expenses, we kind of look at it as hitting the big
Can
six.
I interrupt there for a second? So just for perspective, so we're talking, again, single two-person family, $1,500 deductible for one, $3,000 deductible for the two-person, and a $4,500 deductible for the family. The current plan is a $3,000 deductible for a single, a $6,000 deductible for a two-person, and a $9,000 deductible for a family. That'll, I think, come back when we start talking about deductible.
So with those expenses that are subject to deductible, those are usually those big ticket items, hospital inpatient, x-rays, maternity care delivery, ambulance transport. Those are kind of the things that you would see subject to the deductible. With that LP benefit, I mentioned the diagnostic lab tests and scopic procedures and outpatient surgery. You'll see those highlighted at the bottom. So if you do see an LP provider for lab tests, you would only have a $15 copay. If you see someone who is not considered an LP provider, it would be subject to your deductible. So that kind of takes into the consumerism piece of the plan where your employees are just going to need to make sure that who they're seeing is an LP provider. We have different programs that can assist with that as well. Outpatient surgery and scopic procedures, same concept of seeing an LP provider, but you would be at $100 copay for an LP visit. And then if you see someone who's not, then it's subject to the deductible. Right. The plan has what's called an out-of-pocket maximum, and that acts as a safety net for your employees. So it's broken out as a separate out-of-pocket maximum. So you have your medical and prescription drug maximums. Medical takes into consideration any co-insurance, co-pays, and deductible. And then your prescription drugs are just those prescription drug co-pays. So it's really, if you have someone who's taking in a lot of care and just, is very sick, lots of visits, lots of medications, this just acts as an additional safety net that once you hit that maximum, the entire plan will be covered in its entirety, co-pays included. So right now, you will see that this plan is built on a plan year that runs from July to June. That can and will be changed if the town does decide to move forward with this plan option to run on the calendar year from January to December. We just have a lot of our plans have that capability to run on the fiscal year or the calendar year for their deductible.
It's from July to
June. I did include the plan rates at the bottom. This does include up to 50% deductible funding. So with that lower deductible amounts, you will see a lower funding option as well. I don't know if you want to touch upon the funding for this.
Yeah,
plan
I just
option?
thought, pretty sloppy, so forgive me for it being sloppy, but I was just trying to put into writing the way my mind was working about how to explain this, because by showing you a higher deductible or a lower deductible plan, we're also showing you a higher premium, but we just want to see if we can attempt to explain why that might make sense to do. So again, this is very rough, bear with me here. So if we just look at this little spreadsheet here, I just put this together this afternoon. At the top, it's just a pricing breakdown. So I just wanted to have something to give you so you could just say, okay, what's the bottom line? And so what I've done here is across the top, we have 3 plans. We have the number of enrolled in each type of plan. And so the first one is that HT 2022. That's just your renewal policy. And I've broken it down to what does each plan cost per month, and then did a total monthly. I did that for each of the plans. The health trust renewal our HMO 15, which is the one that we just talked about, is in the middle there. Again, I know it's sloppy, but bear with me. So I just want to talk through this before we get into the HSA, because you might be like, well, you're showing us a plan that costs significantly more. And that's true. And this is why. So if we look at the annual cost of those two plans, you're going to see, based on, again, current enrollments, your current plan annual premium is going to be about $950,000. The plan that we're recommending is $997,000. So you're looking at a difference of about $47,000 and not in our favor. So if that was the end of the story, I think it would just make sense for us to pack up our stuff and leave. But then we want to talk a little bit about the deductible funding, because your cost for these plans aren't limited to the premiums. Again, we talked a little bit about the current plan being funded at the 75% level. So if you go down into the boxes that are, they're not highlighted, but they're actual boxes, then what we're looking at here are what is the total annual exposure to the town from a funding perspective. So funding being, in addition to my premium, I'm also paying for deductibles throughout the year for potentially big amounts of deductibles. So if you look under your current per EE plan there, the per employee exposure. So again, that's the amount of deductible that the town would pay if the employee hit their deductible. So a single employee exposure is $2,250 per year for a two-person. Are you all with me where I am on this page? Okay, a two-person is $4,500 for the year, and then a family, the exposure is $6,750. So if we just multiply the number out by the enrollments, then you're going to see that for the single, the exposure for the year is $40,000. For a two-person, the exposure is $72,000, and for a family, the exposure is $135,000 for a total of $247,500. What that means is that and this is very unlikely, it's never going to happen. If it does happen, we have bigger problems than health insurance premiums. But if everybody on the plan hit their deductibles, then the town would be on the hook for just shy of $250,000 of those deductibles.
Added to the 950?
Yes, right. Right. Now, again, not everybody's going to hit their deductible, but the exposure is there. By cutting your deductible in half, you're keeping the employees' level of exposure the same. So right now they pay $750 per person on the plan. We would keep that exactly the same, but we would cut the deductible from $3,000 to $1,500, and then we do the same thing where we look at what's the proposed per employee exposure, and it goes from $2,250 under the current plan to $750 with a $1,500. It goes from $45 under the current to $15, and then it goes from $6,750 for a family to $2,250 for the proposed. And then we did the same thing, same math, just multiply that out by the number of enrollments and then tally those up. So the total exposure with a $1,500 deductible would be $82,500. So again, same exact situation. If every employee hit their deductible, then the town would be on the hook for an additional $82,500 instead of an extra $247,500. So then I just took one more step and said, okay, what if we hit 50% utilization? So, and who knows? I'm not sure what the number will be at the end of the year. Could be 50%, could be 20%. But this is, again, just to try to explain it conceptually. So if we hit 50% utilization, then the amount of deductible that you would pay, and again, in addition to premium, would be about $123,000. Where under the $1,500 deductible, it would be $41,000. So we're just under that particular instance, you're looking at a difference of $82,000 in deductible payments. So even if we cut that number in half, and say, okay, we only use 25% utilization, then you're still at like a $40,000 savings. And now at that level, I don't know if that's a realistic level, but now the plans start looking a lot more even, with a lot more protection from that exposure that's there from the high deductible. And again, the idea being, we don't change the employees' skin in the game. We don't increase their deductible at all. Is that making sense?
Actually, on the first plan, you're talking about 1.198, almost 1.2. Your plan, the second one you were into, so you're talking about 1.079. So there's quite a bit of savings there.
Could be. Again, it's all
That's at
hypothetical.
100% versus the 50. I understand.
Yeah. Yeah, but
You're offering the same plan, but a little less cost by the deductible.
that's our thinking. And to be perfectly honest with you, we won't know if it works or if it doesn't work until we've gotten through a full plan year. Because if we come back and it turns out nobody used any of their health care, then we're high. But if it's highly utilized, then obviously I think you would be in the black.
Compensates.
Yep. So that's just comparing the current HMO to this proposed
Yes.
HMO for 1,500. But then we have a second health plan that we are recommending as an alternative. So again, this would be something that employees could opt into, and it's also an HMO, but it's an HSA qualified HMO. And an HSA just ties a health savings account to a health plan. And I mean, we could just talk about health savings accounts all night long, but let's not do that. But it is for people that understand it, and for people that are well educated, it can be a great option for them, and it's a much lower cost option. Consumer driven means that the idea is to try to educate our employees in a way where they're able to use their health dollars in the most efficient way possible. So we're always talking about low cost, but not low quality. So Kenz, if you want to walk through that.
Okay. So the second plan option is that HMO HSA. So when you look at that, you're only going to see a handful. When I say handful, 3 items that are going to be covered in full. So that's usually your preventative care. And that also includes the routine eye exam. Everything else on this plan, medical benefits and prescription drugs, are going to be subject to the deductible and then any applicable co-insurance. So with that deductible, if you're on a single plan, you have a $2,000 maximum. And if you're on a family plan, a 2-person or family plan, it's going to be a $4,000 deductible. So you've got, your chiropractic care, we're used to seeing, things used to be subject to a copay, or things that were covered in full previously are now you're going to pay, X, Y, and Z for. So this kind of, allows the employees to become consumers in their healthcare. They have to, try and, they can talk about costs, figure out how it's going to impact their health plan and what they can expect to pay out of pocket. So once that deductible is met, they then have 20% co-insurance. That's going to be on the medical portion of the plan. So with that being said, the plan has a combined out-of-pocket maximum. So you've got your $2,000 individual deductible. I'm going to, when I give my examples, I'm going to refer to the individual plan. So you've got your $2,000 individual deductible, which is going to accumulate towards that $4,000 out-of-pocket maximum. And that's going to also include your prescription drugs. So on this plan, you're first going to pay for your prescriptions towards that $2,000 deductible. And once the deductible has been met, you have 10% co-insurance for your prescriptions. Now, the plan does have script maximums in place, so no one's going to pay $1,000 towards any one prescription. So if you have someone who's going to pick up a 30-day supply, it has a $75 maximum per script and per refill. So you can expect to not pay any more than $75. And then if you have a 90-day supply, which you utilize through the mail order program, that's going to be a $150 maximum per script or refill of a medication. So there is that, safety net for those costs because prescriptions can be very, very costly. So with those items, both going towards your deductible and then the co-insurance, you essentially have $2,000 of the deductible towards the out-of-pocket maximum, and then $2,000 of co-insurance accumulating towards that out-of-pocket maximum on a single plan. So once anyone hits that out-of-pocket maximum, $4,000 for an individual or $8,000 for a two-person or family, that entire health plan, co-pays, prescriptions, medical visits are all going to be covered in its entirety throughout the remainder of the year until the deductible resets. Okay.
Question for you though, real quick.
Yes.
Is that 2,000 just for the employee or is that 2,000 for the town?
So for funding, so this plan is a little bit different. So if you're on a single plan, it'd be $1,000 up to $1,000 for the town. So we're proposing a dollar for dollar match. So, an employee who, might not know how much medical care they're expecting, they might say, you know what, I think I'm going to put $500 of my money into this HSA account. So we're proposing that the town does a dollar for dollar match for that amount. So the town would put in $500 to match that employee's contribution into their HSA. So if you have someone on a single plan, the maximum allowed would be $1,000, and on a two-person or family plan, it'd be a $2,000 funding maximum.
So just to make it clear, so if the town decides to do the HSA, and the town offered, we'll put 2,000, if the employee puts 2,000, and there's their $4,000 deductible matched at that point. After that 4,000, there's no more out-of-pocket expense, the way I understood that. Is that correct?
Correct.
For a single,
For a single.
Single,
Yes.
Yes.
but for a single, I think, were we saying a $4,000
So
or a $2,000
it's a two,
match?
the single would be a maximum of $1,000.
Yeah. So it's
$1,000, but still
Yeah.
4,000 out-of-pocket expense though, correct?
Correct.
Right.
Yes.
right.
So if the town was gonna do, because I was one of the ones behind the HSA account,
Okay.
Okay.
it's at least putting in a certain amount for each employee. Then if a double person, you put more in, family, you put more in, but you match.
Yep.
Almost even, so they're not paying much more than they're paying now, paying a little more, but the benefit in the long run would be no more out-of-pocket expenses at a cap, so they wouldn't ever have to worry about paying anything extra, that's all.
Potentially, it really depends on utilization, but the beauty of the HSA is if you're not hitting your deductibles, this is ongoing. So what we're recommending is saying, hey, one, the point of the match is to incentivize the employees to participate. That's how they put their skin in the game. But if you have somebody who's not hitting their deductibles, they can put in their money and get the match for as long as they want, year after year after year. So you get to a point where you can accumulate some significant dollars into these accounts. And if you're healthy now, but you have some ailments down the road, then what you're saying is exactly what would happen is, well, I've got so many funds in my HSA that I'm covering my deductibles on an annual basis in my out of pockets and so on.
It's all tax-free.
Yes. Yep. Pre-tax dollars, tax-free growth, Yeah, it's a triple tax benefit as long as you're using it for medical. Yep. Yep. So again,
And it's a rollover every
Keep
year.
rolling, yeah, it keeps rolling over
Yep.
each year.
and it's you can treat it much like, it could be like a bank account, but it could be like a 401k. You could have funds in there. You can.
It just accumulates.
Yep.
Now-
That's it.
Yeah. And so with our partner benefit strategies, we'd be able to work with them on administering any HSA accounts if an employee wants to participate in this plan. We do handle the administrative costs for the administration of that plan. So we do all like the monthly invoicing and reconciliation and things like that for you.
And the benefit of a plan like this is, I would say twofold. One is it is a good opportunity to come in and educate employees. And that's another thing we can talk about a little bit. We can do enrollments, but we find enrollments can be overwhelming because there's so much information that we're talking about. But we're happy to come in and do biannual or semi-annual or quarterly trainings. And we would do a more focused session where, hey, we're just going to talk about how the HSA works or something like that. But really, I think the key would be in that education.
Mhm.
So,
Definitely.
but also the second part of the twofold is the pricing. So if we go back to my very rough sheet, you can see the annual premium for the HSA plan is significantly lower than the other two. So again, HSA qualified, so there is more potential for out of pocket if you're hitting those deductibles and out of pockets annually. But also a lot of upside if you start, using your plan efficiently and you're somebody that's not generally hitting your deductibles year after year.
So just to, clarify as well, the network, both plans run on the same network. So it's Harvard Pilgrims, HMO, New England network. So you've got Massachusetts, the Boston Teaching Hospitals, Maine, Vermont, parts of Rhode Island, of course, New Hampshire. But it is a very well-rounded network. We do have a out-of-area dependent network. So if you have, a family plan and you have kids who go to college out of state, they can register as an out-of-area dependent and take care of the United National Network and register to use a healthcare provider as if they were in the network. So that's a nice benefit as well for making sure your college-age kids can continue to receive care.
A lot of information.
It is.
Yeah.
I mean, we can keep going.
I guess I would also say that the New Hampshire Interlocal Trust is a not-for-profit 5B governmental health insurance risk pool registered with the state of New Hampshire. So we're not dealing with a carrier directly. And that to me is a big deal because the purpose of a risk pool is to really charge members as little as possible. We really only want to charge enough in member or premiums to pay the claims and cover the overhead. Anything above that, so if we do make a profit, by statute, we send that money back to members. And I'm sure you're familiar with how that works because you're probably getting returns of surplus now, but we operate in the same capacity. Yep.
Can the Board of Selectmen get a list of hospitals and doctors beforehand who has contracts with Harvard Pilgrim?
Yep. So it's an the directory always changes.
Every time.
Yep. But so that's something that we can access online today. So I can pull that and send it over tomorrow. But, with changes like this, people are concerned about the providers, most importantly, and prescriptions and medications. So I always, let the groups know as well that they can always reach out to me and I can do the research for them on their behalf if that's something that they feel comfortable with doing. But I can send in all the steps and those hard copy directories as well for you.
Next question would be for you on this is an individual sitting in a hospital, say at one hospital. The hospital recommends they get transferred to another hospital. Is it up to the hospital at that point to get the authorization of the patient?
It would be the hospital.
I just want to make sure because there's some out there that it relies on the patient to get the authorization. And that's how you do on a weekend.
No.
Okay, thank you.
That can't be fair.
No, it's not fair.
Somebody's there to be.
No, with Anthem, that's what Anthem does. Because that's why I'm looking at $95,000 bill right now because the hospital didn't get the authorization. The procedure was done. And Anthem's refusing to pay it. So that's why I wanted to make sure. It was up to me to get the responsibility.
Oh, yeah.
Yeah.
Well, I know in some situations, we have groups in the North Country. If a lot of if a heart condition problem happens, they're not going to take someone to a hospital up there. They already automatically go to CMC. And that's always a concern for, groups as well. But, CMC is in the network and things like that. But yeah, I haven't heard of things like that happening
It happens.
before. So it's new.
Trust me.
I think that's another benefit of a self-insured group is we do partner with Harvard Pilgrim. Harvard Pilgrim is a great partner. They're also a not-for-profit, but if I understand correctly, it gives us a little bit of control over things like that.
Do, yeah. And especially with the plan design. So our plans aren't the same plans that Harvard Pilgrim has in their portfolio. We actually have final say in saying, the town of Alton doesn't like having a 60 visit limit for PT, OT, and SD. That's something that we can change down the road. So if you, like particular benefits and how they work, or, you want to change them, that's something that we can always take into consideration. We're not just a cut and dry, this is what you get. We want to make sure that what you offer is what the employees like as well.
Work with it.
Yep.
So you mentioned the network, and that question often comes up with the dental as well. The dental plan that we're recommending is through the standard, and I call it the no network network. The way we've designed it is to be priced at the 95th UNC, which means usual and customary. So it just means based on data of surrounding towns, the coverage limits that are available under the dental will be at or above 95 out of 100 doctors within a 25-mile radius of this zip code. In addition to that, there's a $10 buffer per procedure. So that's a question that comes up with dental. Am I going to be covered? Is my dentist going to accept it? And ultimately, in this case, it's go wherever you want, present your card, and it's in your dentist's best interest to process that claim. That's the fastest way for them to get their money usually. And with the 95th percent UNC plus that $10 per procedure buffer, it minimizes the chance of any kind of balance billing or non-acceptance.
Very good.
I will say, I know we didn't really touch upon them, but Medicare plan options were also included in our proposal. So we would be able to offer plan benefits for those Medicare aged eligible retirees, also through Harvard Pilgrim, but essentially anyone who accepts Medicare, they would receive their care and coverage. We had two plan options, one with prescriptions and one without. Do you have rate sheets for them? I can pass them out if you didn't have copies.
Sure.
Sure. Perfect. But there's two plans at the top and one plan at the bottom, which is considered an alternative plan, but your first two are Harvard Pilgrim medical benefits and prescription drug benefits. So you have, that first plan, similar prescription drug plan where it has those $0 generic medications. Then you have a plan that does not have prescription drug benefits at all. The alternative plan is a little bit different. So this takes in the medical portion from Harvard Pilgrim and pairs it with a PDP plan, which is through Aetna SilverScript. So it takes in that no RX price of $352.01, and it has a PDP rate of $207.33. So that comes in at $559.34. So with that PDP plan, so it is monitored and regulated by Aetna and SilverScript. So you have a medical card from Harvard, and then you'll have a pharmacy card for Aetna. They use CVS for their mail order plan. So it is a 5-tier plan where it does, you still get the $0 generics, but for any 5th-tier medications, you're going to see the highest out of pocket. So that's $50 for a 30-day supply. If you have a 5th-tier medication that you'd want to get through the mail order program, it's just unfortunately not available. They don't, they don't recommend doing the tier 5 medications for a 90-day supply. So those are the Medicare plans. We do internally do any direct retiree billing. So if that's something that the town currently does, we can take that off and handle that administratively for you. We can, be included on your invoice, but then being able just to bill them directly to pay us, is definitely a help. Medicare benefits are usually pretty, self-explanatory, cut and dry, but these are just those options just so that you have them and are aware of them.
Thank you.
Welcome.
What's up right now?
Anything else you'd like to add to the presentation?
We could talk about health insurance all night. There's a lot of information,
Yes,
so.
there is. Yes.
So-
I would just say, you guys know where to find us if other questions do come up. Happy to come back up. Thank you for giving us
Thank you.
a chance.
Thank you both for coming out
Thank
here and
you.
explaining your policies and your program, and we appreciate that very much.
You're very welcome.
Perfect. Thank you.
Thank
All right.
you.
Thank you.
You're welcome.
You're welcome. So we owe you a provider directory. And was there anything else?
Provider and hospital.
Yep. And I'll get specialists as well. I'll include
Specialists, that'd be
specialists too. Yep. I'll do the instructions for medications.
And I realize that's based on normally a 3 to 5 year contract on most hospitals and stuff. They don't do it annually, but you understand that. Could be changing within a year on some. But I'd like to just see how many area physicians and hospitals are covered.
Absolutely.
Good to see.
Okay.
You both.
Awesome.
You're
Thank you.
welcome. Thank you very much.
Good evening.
All right, have a nice night.
You
too now.
Thank you. Any more discussion?
I don't have, I still like to go back and review everything. Just might go back through.
Go over with everything. Thank you. All right, revised 2022 budget sheets for cemetery and grounds and maintenance. Would you like to come up?
Well, do you have an extra copy of that? Because I didn't get into the office before the meeting.
It's like an email on the top.
This one here, right?
I don't believe I have it yet. Look again. Take that back.
You got it?
Yeah, you got it now.
Okay.
Yes, so just to touch base on the email, you have a copy of that in front of you. So these are the revised cemetery department and grounds and maintenance department budget sheets, which were directed following your October 25th meeting. So these sheets reflect the wage increase for the sexton and also change where the proposed new full-time maintenance labor wages. So the cemetery and the grounds and maintenance department were the same for the starting wage of $15.46. Also following your direction, the custodian wage was changed, and that was to reflect your comments about the current wage being too low for the work being performed. Also, the specific comments that were made were the staff's gender and receiving commensurate pay and the skilled tasks that are being performed, and the years of service, which is 7.2 years for the custodian. So I recommended that the custodian's wage be increased from the $16.32 per hour to $17 per hour. And that falls within your minimum and maximum chart that was approved at that October 25th meeting. So those are the changes that are reflected in these sheets.
Looking for that. Page. Oh, here it is. Yeah, I had the wrong page. Got it. I was looking for the custodian.
So the custodian would be in the grounds and maintenance department.
That was 17.
Yes, that was what I was recommending. We can
Mhm,
talk about
recommending
that.
17.
Yes. So the wage structure, minimum and maximum, the minimum is $15.38 and the maximum is $20.07. And with the custodian's years of service of 7.2, I thought that the 68 cents increase was appropriate as a minimum, unless you thought it should be more.
No, I agree. I think you did a good job on that, and I agree with that.
Okay.
I, the one that had the conversation mostly last week with you, you said you were glad to hear it, and this is what you're coming in to recommend for that custodian position for the years of service. I agree with you on that.
Okay.
That looked good.
That's myself personally.
Labor, grounds and maintenance, new full-time labor.
That I will be voting against. I will vote for the custodian if you want to make that a separate motion, but I will not vote for the extra position for grounds and maintenance right now. Or at least not this year.
Okay, so you, as far as the labor, 1841. That's the top one.
That would be the one that we need to fill at this point.
No, the laborer for 1841 is our current employee that has been here. So it would be 10.5 years of service.
Mhm.
That's our existing employee. The second one, laborer 1704 is our absent vacant
It's your open
position.
vacancy. right
Yes.
now. Okay.
Then there's the custodian, then laborer cemetery sexton is our current sexton.
Mhm.
The laborer cemetery full-time is the recommendation for that cemetery seasonal person to be changed to a full-time. And that's
Only
the,
seasonal though, and then going to the buildings and grounds
Correct.
during the winter, correct?
correct. And then lastly is the laborer, which is the new position that was recommended by the selectmen at a previous meeting, and that was put
By
in
the
here.
majority, yes.
By
Correct,
majority. Yeah.
yes.
Would you like to go through each line item and vote on each line item?
No, I don't think so. There's three of us here, and I think two of you are here, were in agreement that night of having those extra positions.
Mhm.
And I can still oppose it. And the record shows how I feel about the custodian's pay anyways. I'm
Okay.
opposing it
But
because
as
of the
far
new
as the
positions.
others,
You can go, ahead- go, somebody, one of you two can make that motion. I will.
I
oppose it.
just, on the labor, the 1841, the 40 hours is the top one. He's been here 10 and a half years.
Correct.
And is there no room for advancement there or anything? Why are we still labor after 10 and a half years?
Because it's,
And
I
I'm
know
just
that-
asking, just
Yeah.
because, I mean, it seems 10 and a half years paying somebody $18 an hour. Maybe we ought to think about that. a little
well,
bit.
but this person also got transferred down from the solid waste. center,
Correct.
Correct. So
Yep.
most of the years was at the solid waste center, correct?
They started out as a seasonal laborer for grounds and maintenance, and they went to the solid waste center. I'm not sure how many years, a few years, and then they took a full-time position with grounds and maintenance.
But possibly when the buildings and ground goes over to the public works department, maybe there'll be more advancement there depending how that's orchestrated through for that individual. I would
Okay,
think.
yeah, no, I had that, but it
I can
seems
see
like a
why
lot
you,
of
I saw
years.
you, that's why you were asking.
Seems like a lot of years to
I
be
Yeah.
understand that.
sitting in a laborer's position and only getting paid $18 an hour. I mean, that's just barely enough to live off, if it is even enough.
And the maximum, according to your wage chart, is $20.19. And to answer your question, there is no room for advancement in
Now,
that
that's
The
department.
end of the min-max
Yes.
chart, the end of the min-max chart, how many years is that where they'd be at full pay?
I'm not sure that's taken into consideration or how this is. Things have changed with the step and wage chart as opposed to this,
No, I
so
understand that.
yeah.
It's a pleasure to go over this time.
One more comment, the 1841 would also reflect, or it'd be in addition to a merit pay. So it would be about 1905 would be the final pay.
Okay. And that's at the end. And I'm looking at it and I'm going, well, geez, we got a guy here that's been here 10 and a half years. And he's gonna be making 19, and then we got a laborer that's coming in at,
17.
just started at 1704. That doesn't seem, is that,
My thoughts on that was I'm looking for a laborer for that 1704 to have the skills of a tenure person. And to not be someone that's being trained or being driven around and to be able
Somebody, yeah.
to work independently.
all right, no, if you're
Um,
comfortable with it,
And if we don't have that person, then they wouldn't receive that wage.
okay.
And you're comfortable with the laborer cemetery sexton
Yes,
from November 29th, February 26th for 13 weeks?
yes,
Again, that's at 1850.
correct.
We have a motion.
Yeah, I'll make the motion to accept as presented.
Second.
You have to.
I
make-
second.
You have to make the second.
I just wanted to give you one more chance.
Sir.
Thought I'd look at you. Okay. All in favor?
I,
Aye.
Opposed, aye.
That it?
Okay, thank you very much.
All right,
thank you.
thank you,
Good work.
thank you.
Thank thanks for putting this together.
Yes, thank you very much for the opportunity.
Business. This, Laura?
Yeah, you should have at your desk the insurance budget that you approved, the MSI
Yes.
worksheet,
This one here?
yeah. So they just submitted, a reduction to the workers' compensation, to the workers' compensation because of the hazard pay that they included in our, wages when they gave us our quote this year. So there is a reduction that we can take of $3,833.
Off the 164?
Yep, if you would like to do that, or you can leave it the same. That's totally up to you. I have those here if you want to see those.
Sure.
How much was it again, Laura? I'm sorry. Oh, you got it.
Reduction of 3,000. Deduct 3,000.
If that's what you choose to do with the workers' comp
Thank you.
paper that we sent.
Reduction of $3,833.
Mr. Chair, make a motion to revise the workers' compensation line from 164, 464 to 166.31 for the year 2022, revising the bottom line of insurance budget to 293 to 352.
Second.
All in favor?
Aye.
Aye.
Aye. Okay. Anything else, Liz? Think of? Laura?
So you're gonna have to come revisit the grounds and maintenance budget then at the bottom, so you can vote on a new bottom line, yes? Because it's all over the place right now, okay. Just making sure.
The
I
next
also-
time we meet.
Yeah,
Yes, yes, on that one.
okay, I also just have a couple handouts for you.
Mhm.
I believe Ruben had asked to see what does it cost for a full-time new hire employee. So I have them from different departments at the lowest starting pay. So if you give, increases in those numbers, it's gonna change your bottom number. Then I also have, you wanted to know what we paid in property
Mhm.
liability out this year. So I was able to run those through privates. It's just an FYI task work. So
Thank you.
so for the new hires, I mean, just as an example, a new firefighter employee at the lowest starting pay that he quoted me would cost you about little over $96,000 a year for one. As you can see, his starting pay would be $19.50. The new grounds and maintenance
At
at
$19.50.
$15.46 would cost you the $67,551. On the second page, you have your highway truck driver. I went with that rate at the $18.44 an hour, would be the $75,659, and a new police officer certified regular patrolman at the $26.03 would cost you the $107,041. Just as an FYI.
And that's the regular patrol.
Yeah, that's one of the lowest paid. Yep. It's just as a,
No, that's big help. When you hire a new individual,
yep,
it's on that side of the scale. It's not just the salary. You're talking 107,041 for a new police officer, 75,000 for 659 for a truck driver. The other question, now that the Board of Selectmen approved that budget, you're still gonna have to go through the FICA and everything else and redo those bottom lines, correct?
you can,
The-
Normally-
The numbers are gonna change because
yeah,
if you
but
just
they're
added,
estimated
you
anyways.
just added 2 new positions.
Yeah.
To it, plus any other positions that were added on, that's gonna change your FICA and everything else, so that's gonna change your bottom line budget and those.
Changes a
areas.
lot of budgets in the long
So
run.
we're gonna have to go back through and approve those budgets again and resubmit to the budget committee. Based on salaries before we approve new positions. So it's not just a recreation department, there's gonna be a few departments we're gonna have to change.
Yeah, definitely.
And insurances, which we haven't
Go through
done
them.
yet anyways, but
The fire department employee, that is a just level, entry level firefighter?
I called Chief Bowden and asked him what his new hires would be starting around, and that's what he.
That would be,
Just an
again,
estimate.
your entry level firefighter.
But that's only for full-time with that,
Correct.
right?
Right,
Which
because
is
now
only,
they're considered full-time. They get the benefits of the retirement and all that.
which is what, 3 full-timers down there now, correct? Fire department. There's only 3 positions that are full-time, the chief,
Yes, that's correct.
the secretary, and
The captain.
captain.
And then you just approved 2 new ones to start mid-year, 20 after our vote.
I didn't know.
Well, the board,
That's what we're adding a lot of
Majority of-
positions to the town this year.
So we will have to review.
well, that's just, yeah, I mean, that's up to the board, but
Yep.
that's all I have.
All right. Any other discussion?
I'll make a motion to adjourn.
Second.
All in favor? All right. Thank you, everyone.
When do you want to revisit the